Researchers include identified 2 biomarkers how could assist in the diagnostic of a cardiac state how raises the hazard of course. Atrial ventricular fibrillation, AF, is the largest overall cardiac beat perturbation, touching about human beings in the UK. But it is frequently just detected following who has had a course. The UK cardiac basis told the research could cover the way to superior detect of human beings in AF and aim treat. At the time, an ECG, electrocardiogram, that measures the electric operation of yours cardiac, is normally utilized to display patients for atrial ventricular fibrillation. The research, by researchers at the College of Birmingham, found how 3 clinic hazard factors and 2 biomarkers had a powerful connect in AF. Such largest at hazard of the state were older men and had a top BMI. The researchers looked at 638 clinic patients who were enlisted among 2014 and 2016 for severe illnesses. They took bloodstream samples of production and looked for 40 vascular biomarkers and deliberate 7 clinic hazard factors: year, sex, hypertonia, cardiac fail, story of course or transitory ischemic assault, renal feature and flesh massive code, BMI. They were as well all taking into account an echocardiography. 2 biomarkers stood out as a connection to atrial ventricular fibrillation, the researchers found. One is a hormonal emitted by the cardiac named marrow-natriuretic peptide, BNP, and the some is a fiber accountable for phosphorite regulatory named fibroblast increase element 23, FGF23. The researchers say these human beings could be shielded for the state by test their bloodstream to see if they include lofty levels of the 2 biomarkers. Conduct writer Yanish Perma told, "This biomarkers we identified include the capacity to be utilized in a bloodstream testing in society configure such as in GP practices to facilitate patient choice for ECG screen." Collaborative at first writer Dr. Winnie Chua told, "Human beings in atrial ventricular fibrillation are lot more than potential to evolve bloodstream blood clots and afflict of strokes. To escape strokes it is essential for them to get anticoagulant drugs to hinder bloodstream coagulation. Yet, atrial ventricular fibrillation is frequently just undiagnosed following a patient has incurred a course. Thus it is essential how patients at hazard are shielded so how they can take anticoagulants to hinder potential lifetime-threatening complications." Professor Meedan Kiran, Connect Care CEO at the UK Cardiac Basis, welcomed the research. Atrial ventricular fibrillation increases the hazard of course, a severe state how causes above 36,000 deaths in the UK every year, but is frequently detected to deceased. The study has utilized subtle statistics and car training methods to analyze patient information and provides hopeful testimony how a conjunction of lightweight to measure indices may be utilized to forecast atrial ventricular fibrillation. This research may cover the way to superior detect of human beings in AF and their aim treat in bloodstream thinning medication for the preventive of course and its destructive ensuing consequences.